Have you ever wondered why your heart beats? It beats to keep the blood flowing throughout the body and thereby supplying the cells with the much-needed oxygen. When we breathe in, oxygen is absorbed into the bloodstream through the lungs and travels through the blood vessels to reach the tissues and cells. Oxygenated blood is pumped from the heart through arteries that eventually branch into microscopic vessels called capillaries. The capillaries are responsible for delivering oxygen to the tissues and collecting carbon dioxide and other waste products, which are then transported back to the heart through the veins. The blood flow is therefore crucial in delivering oxygen and is increased when the demand for oxygen is increased. The blood flow, and thereby oxygen delivery, is affected by the heart function, which in turn is affected by several factors. Heart function can be divided into heart rate, how many times the heart beats per minute, and stroke volume, which is the volume the heart pumps every heartbeat. Injury or other stress on the body reflexively increases both the heart rate and stroke volume, increasing the blood flow. Low blood volume due to blood loss or dehydration or heart disease, such as congestive heart failure, lead to a decrease in stroke volume. Whether this affects the blood flow depends on how heart rate and stroke volume can compensate for each other. The pulse can provide important insights into a patient's overall circulation. It can be felt at different locations in the body, such as the wrist, groin, and neck, and changes in pulse rate and strength can be an early sign of illness or injury. The location of the pulse reflects the blood pressure. The lower the blood pressure, the more centralized the circulation. In response to low blood pressure, the body activates compensatory mechanisms, such as narrowing of the blood vessels in the extremities and increased heart rate to maintain blood flow to the vital organs. This may result in a more centralized pulse as the body redirects blood flow to critical areas. The ultimate goal of these reflexes is to maximize oxygen delivery to the body's vital organs, such as the brain and heart. If blood pressure decreases, the pulse disappears first from the wrist, then the groin, and lastly the neck. The pulse's fullness can indicate blood volume. A thin, weak pulse may suggest low volume due to blood loss or dehydration. The pulse rate should be regular and not too slow or too fast, providing information on the heart rate. A strong and regular pulse in the wrist suggests proper heart function and adequate circulation, while a weak and rapid pulse felt only in the neck indicates a problem with the circulation. In summary, the heart is responsible for pumping oxygenated blood throughout the body. The pulse is a measure of the pressure wave created by the heart's contraction and is felt as a rhythmic beating in various parts of the body. The pulse rate, strength, and regularity provide important information about a person's health and can be used to monitor circulation and detect early signs of illness or injury. By understanding how blood flows through the body and how the heart functions to maintain circulation, you can assess a patient's circulation and potential health conditions.